Hi, my name is Jeff Gorder. I'm the sports pharmacist here at Dakota Pharmacy. And today I'm going to talk about probably the 5 biggest questions I get as a sports pharmacist. Number one question I get is, what is sports pharmacy? And that is a pharmacist that usually works with athletes, whether it be in a team setting or an individual setting, that help them manage any medications, prescription drug medications that they may be using, managing any banned substance lists, such as by either World Anti-Doping Association or U.S. Anti-Doping Association, and then helping manage any what they call TUEs or therapeutic use exemptions, which if you are on certain prescription medications do need what's called a TUE to be able to use them, and some are allowed in and out of the competition. It all depends. So that's a couple of aspects that a sports pharmacist does. Also, a sports pharmacy looks at supplements and how they can use supplements to maximize benefit, and then we also can delve into nutrition, because nutrition and supplements fit in really well. So we work with both individual athletes and team athletes. And then we can also do information type lectures is for booster clubs, for teams, in regards to safe supplement use, any safe medication use, or things such as like hidden caffeine, and all those types of things. So that's really what a sports pharmacist does. And then probably the second biggest question I always get is, what is in regards to creatine, what dose of creatine I should be taking, and should I be taking creatine every day? Me personally, I think we should be taking creatine every day. Although if you only want to use it while you're exercising on days of exercise, that's fine too. But I really think the maximum benefit from creatine is using it daily, and probably using about 5 grams a day. Some data coming out, higher doses help support some brain health. But if you're looking at just from a sports performance basis where muscle benefit, really 5 grams is all you need. You don't need to load the dose. You don't need to do any of that. Just 5 grams a day would be suffice. Third question I get is, why would I consult a sports pharmacist if I'm not actually a drug tested athlete? And the reason being, and I kind of go back to like younger athletes in this, athletes that are in their early teens, maybe into high school, and they're going to be going into the college level, or good enough to play at a higher level where they could be drug tested. I think it's really important that we make sure that any medications that they're using or any supplements that they're using are going to be considered safe and will not cause a problem when they do become a drug tested athlete. And then the other reason I think you should consult a sports pharmacist if you're not being drug tested. You want to make sure you're using supplements that are safe for you, even though you're not being tested. You want to make sure they're safe. They're not going to cause any harm or be detrimental to you health-wise. And I think the fifth question I get mostly is, how would I benefit from having a sports pharmacist or working with a sports pharmacist? Especially in young athletes, or even an adult athlete that has a full-time job and just trains on the weekends or races on the weekends. And really, we're going to help you be able to choose the supplements that are going to work best for you. Young athletes, we're going to help you kind of look at their nutrition, what supplements you should be using, what supplements you shouldn't be using, especially based on their age, and really help hone in on those things in that aspect. If you have any medications, are we using medications that aren't giving you the most bang for your buck? Could we use something that's going to help you with your disease state, but still maximize your sports performance? That's really why everybody should work with a sports pharmacist. Also, myself, I am a certified nutrition coach as a sports pharmacist. So for me, I work with a lot of people that will contact me and be like, I just want to know what to eat or how I can eat better to just feel better every day, or work out better, or lose a few pounds. And that's really, I do a lot of that also, and a lot of the supplement questions and stuff like that. In other words, working with sports pharmacy, especially myself, we do genetic testing here to help you kind of hone in on your supplements that you should be using, and also nutrition. And then we can also help hone in on your performance, your recovery, and all that stuff also.